Welcome to Module 10, the role of licensed acupuncturists in type 2 diabetes care. We're going to talk about their education, their treatment approach, and integration into healthcare teams. Now, this is something I really advocate, that everybody who has type 2 diabetes, part of their healthcare team should and needs to be included is a licensed acupuncturist, a doctor of Chinese medicine. Because along with your healthcare team, you have your primary care, you have your nutritionist, your endocrinologist, your podiatrist, amongst others. And then also you should have a licensed acupuncturist. So I want to talk about some of the education and training of a licensed acupuncturist. Now, to become a licensed acupuncturist, you do need a master's degree, and this master's degree takes an additional 3 to 4 years. So first you have like your bachelor's degree, and then you go to acupuncture school, which you get your master's degree in about 3 or 4 years of advanced education. And then to continue, you can get your license as a master's degree to become a licensed acupuncturist. But then many go on to get their doctorate degree, and that can be an additional 1 or 2 years. So all this from the doctorate degree, it's about 4 or 5, about 6 years or so of education to become a licensed acupuncturist. And then you have 3,000 plus, so I said the plus clinical hours of hands-on training and whatnot. We get a lot of information, Western and Eastern medicine, study of anatomy, physiology, pathology, pharmacology. So pharmacology of the Western medication, and then Eastern herbs, right? And then we understand the body and pathology from the Western perspective, like what your MD will understand or nurses will understand. And then we understand it from an Eastern perspective of what's going on in your body and what imbalances you have. And then again, we have the study of anatomy and physiology, right? Because we are sticking needles in your body. So we definitely need to know the actual location of those points, and you have to know your anatomy. And then we take a board certified, state boards required. I am licensed in the state of California, so we take our state boards, and then you have nationals where you can kind of practice anywhere in the United States. How acupuncturists treat pain and internal conditions. These are just simplified answers, nothing too complicated, but I want you to understand acupuncture modulates the nervous system and reduces inflammation, right? And we know that inflammation is kind of the key to all diseases. Yes. And then also herbal medicine supports our organ functions and our metabolic health. And then manual therapies that we do, such as like a Tui Na massage or cupping or moxibustion, where we burn some of the herbs and places on your body. It helps to improve the circulation in your body. And then we do lifestyle counseling, such as diet recommendations based on TCM. And then exercises based on like what organ system needs to be improved or whatnot from a TCM perspective. Acupuncturists in the state of California, where I am, we have a status of primary care. We're primary health care providers recognized officially in California, and we can practice independent with no physician referral needed. We have the authority to order labs and imaging, and then we do comprehensive care of diagnosing, treat, and managing conditions. Now, acupuncture and TCM for type 2 diabetes management. Acupuncture and herbs, number one, helps, and we have evidence-based information that it helps blood sugar regulation, improves insulin sensitivity. And then, like personally, when I prescribe some herbs, custom formulas for patients, it helps to regulate their blood sugar and improve their insulin sensitivity, reducing inflammation, and supporting the organ function for metabolic balance. And again, like from the previous slides, acupuncturists look at your tone, your pulse. We ask a lot of questions, and then based off that information, we get an idea of what a system in your body is deficient, like if it's your kidneys, if your liver, is your spleen, things like that. And so based on that information, we can provide a custom herbal formula to help support that. And in doing that, we also help support and regulate your blood sugar and improving your insulin sensitivity and reducing inflammation. Okay, and then the enhanced circulation is with the moxibustion and cupping that we do. And then also acupuncture, yes, it reduces stress. And that is a big deal because stress causes your sugar to rise. And especially, if you ever got in an argument or mad about something and then you check your sugar afterward, what is it? Your sugar is super high. So that lets you know that stress causes high glucose. And acupuncture reduces that stress. So an integrative approach, combining Eastern and Western medicine. So yes, number one, medical collaboration. Acupuncturists work with endocrinologists and primary care doctors and your whole care team, right? So you can just mention that to your doctor. I'm working with this acupuncturist, doctor of acupuncture, and they can, we can most likely get your reports from them, your chart, and then you can go back to them. They may ask for something from us, right? And so in number two, data-driven. Use lab results for personalized care and interpret for TCM diagnosis. So even like when I see patients, I ask them to bring in their lab results from the doctor, and I kind of look at them. And from a previous module in the course, I mentioned about these lab results, and us as doctors of acupuncture and integrative medicine, what we see when we look at those lab results, it helps us to better treat you in a TCM perspective, which points we will use, which herbs we will prescribe you, and whatnot. And also root causes. Seeing an acupuncturist, they really address your stress, your digestion, and inflammation, right? It's not just one pill fixes everything, but we try to get to the root cause of what's going on and why are you having this inflammation, or why, what's going on in your digestion and what do we need to help, right? And then medication support. Assist with supervised medication management. So your primary care doctor, primarily, they are managing your medication. But if we start to see signs of like, maybe you don't see your doctor for another 3 months or so, but you see us weekly or every 2 weeks, and then we see that your sugar may be a little too low because things are starting to improve, and we would mention to you, hey, reach out to your doctor maybe about lowering your medication because you've consistently been coming with these lower numbers, and working with us and working with them is a good thing, and that you may also get to reduce your medication. So that's why you also get the medication support. Why acupuncture should be part of a diabetes team. Again, just review. It's a holistic approach. You can help reduce your dependency on medication. For also metabolic support, assist with weight and blood sugar, and then symptom management, and really helping with diabetic neuropathy, which many people with diabetes have, and then fatigue, brain fog, or stuff like that. So these are things that we can help you with, and yeah. Call to action, expanding diabetes care teams. So I have this picture above. You can't see their faces, but the doctor of acupuncture on your left, your MDs in the middle, the patient, you right there with the brown shirt, and then the endocrinologist on the end. So I really want to advocate and just help people to recognize that acupuncturists play a key role in becoming a diabetes healthcare provider and part of your team. Number two, advocate for coverage. So with insurance, or which even your doctor, ask them, hey, I heard about this, about acupuncture and doctor of acupuncture and integrative medicine, what they're doing and helping people with diabetes. Can I get a referral? Or and if you're getting good results with seeing a doctor of acupuncture, mention that to your doctor. They're like, hey, I noticed this. Oh yeah, I'm seeing a doctor of acupuncture. So maybe even educating them about the benefits of Chinese medicine. And then seeking integrative care, combining again Eastern and Western approaches. So that's kind of what this picture shows. It shows we're integrative care. Like everybody brings something to the table that's beneficial. The endocrinologist, the MD, the doctor of acupuncture, the nutritionist. Like we're all here for you and to help you. And then again, improve outcomes, a holistic evidence-based support. And I did my doctoral dissertation about teaching other acupuncturists how to help and manage people with type 2 diabetes. And I did a lot of study and research on evidence-based material, evidence-based why acupuncture works to help insulin resistance, help with diabetic neuropathy, and then also herbs and formulas that has proven to help lower your A1C. And so this is real and it helps, and I just want to try to encourage everyone to integrate this into their care.